If you've been putting off those smile goals, this is your sign. I'm joined by Dr. Mark Nation from Advanced Dental Solutions to talk about confidence-boosting options tailored for anyone. We're talking about smile makeovers to same-day crowns. Dr. Nation, great to have you here.
Well, thank you, Claudia.
Now, you're not a dentist as we might other describe. You've got a very special name that I'll let you pronounce and kind of explain what that means exactly, and how it allows you to do the work that you do so well at Advanced Dental Solutions.
Well, thanks for having me here this morning, Claudia. I am a prosthodontist. Ooh. I know that's a big word, right?
How is that different from a dentist?
Well, that's different. I'm a specialist. I'm a recognized specialist in dentistry. I go to school for 3 more years than a general dentist, and I am trained to completely rebuild the mouth. That's all I do every day.
And what types of cases do you treat at Advanced Dental Solutions, and how do those full mouth dental implants come into play?
Well, so we treat various cases. Patients that have teeth that are broken down from age, time, maybe they grind their teeth, maybe they have erosion, maybe they have a lot of reflux issues. Sometimes I treat patients that have congenital defects, such as children that are born with missing teeth, or children that have teeth that are malformed. So they grow up, and then I'm able to restore their mouth as it should have been. I also deal with accident victims as well. But most of my cases are patients that just have had a lifelong time with their teeth. They've probably had trouble, maybe they had fear of the dentist, and it's time. They want to be normal, and so I give them that opportunity.
I can only imagine, well, most people dread going to the dentist, quite frankly, right? Because they know, oh, I've got to do all this work. But how has the technology changed over time to allow you to do what you do to help these folks?
That's a great question. So with my training and the digital workflow, so we're able to do everything digitally. When you come to see me now, I can do a CAT scan. I can do an optical scan. We then can chart and look at your entire face, your bones, and your teeth all at the same time. I can make a virtual patient. And this workflow allows me to put together a treatment plan that will give you the exact results that you deserve. That way we can be efficient, we can be fast, and we can do it in as few appointments as possible.
I can honestly say, don't worry, we got this.
Right.
It's going to be just fine. So who is an ideal candidate, would you say? Are the full mouth kind of procedures, are those becoming more common where you can go in and do a lot of work? Who would be an ideal candidate for something like that?
Well, the ideal candidate is the candidate that just has lost all of their teeth. They're wanting a solution that is not dentures, that is not a life of not knowing what to show their face. They don't know how they're going to eat, the social implications of such. We're able to change those patients very, very quickly. The other cases that we see are those cases where patients, they've just worn their teeth out. They've had a lot of issues over time, or maybe they're on multiple medications and their mouth is really dry. Medicine does play a role in dentistry. I see lots of cases like that. So these medicines can destroy teeth. Patients don't understand that. I see lots of patients in the latter parts of their life who are just trying to live, and those medications they're taking are literally destroying their mouths. And they're like, Dr. Nation, I want to be able to chew, I want to be able to smile, but my teeth, every time I go to the dentist, I have a problem. Why is that? I'm trained to learn why that is, and I'm also trained to fix the problem.
I can only imagine the responses that you get back from people that have had great success. What do you hear that makes you kind of tweak the process and also know with success and confidence this is working?
You know, every week in our office, there's someone who comes out of our doors that is happy that they're normal again. And we are a teaching office. I have residents in my office, I have other dentists in my office, and from each case, we record those cases, we criticize those cases, and we learn from those cases. Claudia, I've been doing full mouth reconstruction in the Kentucky area for 25 years. I have quite a bit of knowledge. I teach at the university, and so I'm able to give patients not only insights into why their mouth is breaking down, but I can also give them every option available that matches what their needs are, financially, personally, emotionally. That's really what separates us from everyone else.
All right, Dr. Nation, great to meet you. Thank you so much. If you would like to get started, maybe you just want to come in for a consult to begin the process. To learn more, go to adslouisville.com.